So you have knee pain right in the front of your knees as you go up a step or as you sit down or stand up from a chair. So I'm going to give you some things to look at. And if these things are positive, then the problem is probably not the strength of your quads or the strength of your hamstrings. The problem is going to be more at the hip. So I'm just going to give you assessment today, some of the ways to really look and see if the problem is at the hip. And then tomorrow, let's come back and do some strength training specifically for those hip muscles that can help. I'm Stephanie Carter Kelly. I'm a physical therapist that uses yoga in everything I do. So the lessons of assessment just gives you information about yourself. Let's do a little study on ourselves. That's what yoga is all about. It's about looking inward to do a little bit of self-study. So here's how I like to describe what's going on in the knee, in the front of the knee, is you have this kneecap. This kneecap floats on top of the big thigh bone, your femur. So you've got the patella on the femur. And sometimes we can think of that patella as a locomotive, a train in essence, inside the grooves of the femur. There's a track. The femur provides a track for that patella to move on. And when you have pain, it might be because that train is just slightly off its track. So we want to make sure that the patella stays within the groove of the femur. We want to keep that train on the track. So here are some ways to look to see if you've got a train on the track problem or a patella femoral problem. It's not tracking right. So let's take a step first. So I just have a small step and go up and down. My head's going to get cut off. That's okay. But when you go up and down a step, this is a small one. I want you to go up the stairs as you normally would. And I want you to, as you go up the stairs, I want you to take a peek down at your knee and see what you see. I just only have one, so I'm just going to go up and down. What you want to see as you're going up, and then you can turn around your stairs and go down, is you want to see your knee track right out over your toes as you go up and down. A higher step may indicate that it might be a little more challenging. So my small step here is not really challenging me. But if you see, when you peek down, if you look down and you see that your knee goes inside, especially on the lowering, if you see that knee kind of circle, I'm exaggerating, but if you see that knee goes inward, when you go both up or when you go down, you get a little sway inward in those knees. It indicates that the problem is more in the hip. We need these hip muscles to keep the femur in the right position so that the kneecap can track correctly in the grooves of the femur. So the hip muscles pull this leg out and rotate the thigh out, rotate the femur out so that it can go straight up and down. That knee can track right over the ankle. Well, this is just one of the reasons why we have this. But in the research, we have seen that if we train these hip muscles rather than the thigh muscles, we can relieve some of the pain at the knee. But it's only going to work if you have this problem. So if you see that little dive of the knee inward as you go up and down stairs. Same thing as you go up and down out of a chair. So what you might do up and down of a chair is get yourself fatigued. Do this a few times. Sit and stand a few times. And then you want to take a peek. What's happening at your knees? If you see your knees dive inward as you go to stand or dive inward as you go to sit, that's an indication again that the problem, you feel it in the knees, right? It's painful in the knees, but the problem is up at the hips. We need hip strength of the muscles that rotate that thigh out and that pull the thigh out in order to keep this position. So if they're diving in, they're weak here and they're not keeping that position. So if you have that problem, see if you can use the muscles, push those knees apart and keep them so that they're going straight out over the toes. You know, you want to be able to see maybe the inside of the ankles, the inside edge of the foot as you go from sit to stand. See how that feels. The lower you go, the more challenge that you're going to have. And you know, for women, it's a challenge from a social aspect. When we sit down, we want to pinch our knees together, right? I grew up wearing skirts and dresses. I don't wear them so much anymore, but in a skirt and a dress, you're told to keep those knees pinched together. So it's a little bit of a challenge for us to separate our knees and go from sit to stand. That habit of rolling the thighs in, pulling the knees together, it's more of a social, environmental thing that you have to overcome, just as much as you might need to overcome some of the weakness that you have in those legs. So see first, try this and see first if you can just do it. Like if you can really think about it, see those knees and train yourself to move those knees straight forward rather than letting them pinch together. And if you can do it, then just become consciously aware of that so that you're doing that activity with repetition. Now, if you can't consciously do it, tomorrow we'll talk about, what time do I do it? Like 2 o'clock Eastern Standard Time, 11 o'clock on the Pacific Time. I come back and we'll spend a little time doing some strengthening exercises of your hip muscles in order for you to be able to train for this and improve how you move. Okay? Glad you came today to check this out. But if you have pain right in the front of the knees, we're going to look at the hip as the source. And if you have pain in the front of the knees, it's nice to like kind of rest these thigh muscles and come up to the hip muscles and work on strengthening them first while we give this area a little bit of rest, less irritation. All right, let me know how your knees feel as you do these tests, whether you're stepping up and down on a step, in and out of a chair. Can you keep your knees in line with your ankles and your hips? Or are they diving in as you do that? Let me know. I'm curious. Have a great rest of your day. Namaste.